Good afternoon. I am Francis Crawley. I'm a member of the International Data Policy Committee of CODATA, together with Professor Virginia Murray. And we have an opening presentation for you. I will just give a few slides and then the real work will come from Professor Virginia. We also have Dr. Ingvild with us here from the beautiful place in Norway. I forget the name again. And the most beautiful place. And then also we have a recording from Professor Bochek, who's part of our team. Let's see where we are. So what happened? Together with UNESCO and CODATA, the International Data Policy Committee, we put together a working group too long ago, 2 years ago, Virginia? 2 years ago. Okay, Virginia continues to remind me that we are slow. But we put together a working group to try to understand how we could better facilitate cooperation during crisis situations. And by crisis situations, we had in mind public health emergencies, we had in mind disasters, and also geopolitical conflicts. And we tried to look at that from the point of view of data, because we thought that if there was better information exchange during crises, we'd be better positioned to prepare for the crises, as well as to respond to the crisis, and eventually also to recover from the crisis. So we spent 3 years writing 3 tiny documents, only a few pages each. I think Professor Virginia has already shared some of them with you today, and you can get more from her. We are very happy to share our propaganda. And we want not only to share it, we want you guys to do something and implement it. So the name of the project was Developing Data Policies for Times of Crises, facilitated by open science. So we did this within the UNESCO Open Science Framework. Virginia will speak about that more. And we did it as contributions to the Open Science Toolkit. Ingvild, Virginia, and I, we decided we're going to start today with the next steps. We'll come back to the next steps at the end again, but we just want you to know where we're going with them. We have these documents. We have these PDFs. They exist somewhere on the Ethernet as well as in some of your hands. But that's all they do, and they don't do much. So we have to move forward from here, more propaganda, and we have to get this really implemented, because we believe that if we can facilitate the flow of data, the exchange of data, the sharing of data during humanitarian and other kinds of crises, that we can really do a lot to improve those crises. So we launched these on the 4th of June at UNESCO's headquarters in Paris with Virginia, with Ingvild, and with others. And it was a very good launch, but again, we're still at the PDF stage here. So the next phase really involves piloting these 3 documents, the fact sheet, the guidance, and the checklist that hopefully will support data exchange during crisis situations. And we are now working with UNESCO to develop, let's say, a pilot call that should come out early next year. And we're also working with other groups and organizations to try to get direct implementation into things like data management plans and into cross-organizational cooperation. So we'll try to launch this call at the beginning of 2026. We want to test these three documents that make up part of the UNESCO Open Science Toolkit. We want to do it in diverse regional and institutional context. That's why you people are here, because you people will have to do the hard work. We did the easy part. And we want them adopted, and translated into local relevance. We really want them to be at the source where they're needed by the people and by the communities. And we think, and actually believe really, that open science will facilitate this. And I think we were really privileged to have the support of UNESCO and really strong support of UNESCO. They worked with us hand in hand in developing these. And we'll try to also develop a tool, an operationalizing tool, digital tool that will help people to also implement these and work with them as well. And then also, actually we're working also with some other organizations. We have a proposal in to deliver a training program. We gave a training program recently in Chengdu, and we will give other training programs as well to build institutional capacity and to promote responsible data stewardship. By the way, this is the language from UNESCO. This is not our language. And then we want to synthesize these lessons into global policy dialogues. So what we'll see here today is we'll have the opening presentation from Professor Virginia, then we'll have two lightning case presentations, one from Professor Ingvil and one from Professor Borchak. And then we'll have a chance really to discuss with you and hopefully get from you the insights that we need to go forward here. Virginia and I last week thought about the importance of Australia and the place that we would be, and Brisbane in itself. And we looked for ways to think about how we could situate this kind of abstract digital talk about data policies and times of crisis and what's important. So we found this poem, this saying or so, on the internet, of course. It's called The Child's Question, and this will lead us into our first discussion. The small fire, why, it asks, the elder's hand, we're all well. The old land embraces, the dreaming song embraces. We really have to think about, and that's what we have to think about with regard to these data policies. In open science, we have to think about the relationship between our digital environment and our natural environment. We have to think about our relationship between science as we practice it in the digital world and science or knowledge as people practice it in their everyday lives. And we have to be able to connect this. And hopefully we can make some small contributions here. Professor Virginia.
Francis is, oops, sorry everybody, I've broken it already, okay. So it's a huge pleasure to be with you all. And I've tried to share a few copies of the material. And if you haven't got it, please let us know and we'll try and make sure you get them because they're sitting on the table outside for CODATA. So my name is Virginia Murray, and my real concern is looking at this poem, we thought we needed to share crises that happen in Australia in this area, to try and explain why we need crisis policy in times, why we need data policy in times of crises facilitated by open science. So inevitably, because this talks about communal well-being and fires, we have to start with Australian bushfires. There's been a huge problems, as you know, and this comes from the 2024 fires, and we are coming up to the season of bushfires again for Australia, and I hope to goodness they're not as bad. But let me take you to one which is rather older. This is 2017. It was tropical cyclone Debbie that came in and hit Australia and resulted in the most massive flooding. I was very privileged in so much that, because I've done a lot of work in the UK as I'm head of Global Disaster Risk Reduction at the UK Health Security Agency, to be invited to come and talk to them about the work we've done on flooding and to engage about how they might help Lismore recover from these terrible floods. And of course, they've had a lot more flooding since then, but we've done a lot of discussion about it. But as we sit in Brisbane, I thought it would be important to remember Cyclone Alfred. This was a rare storm to hit Australia's east coast. Fortunately, there were no deaths, but there was a lot of damage, and certainly Byron Bay and other places lost a lot of their sand. A massive, massive problem for them. But I thought we should look at some of the more longer-term issues that have caused such concern. And you've only got to look at the incredible value to the whole world of the Great Barrier Reef to know that coral bleaching is truly shocking and really frightening. And I just wanted to put the fact that these crises affect us all. And we need to be much more ready than we are. Francis, there's another poem. You're going to come and read it? Because he's the poem man. Isn't that wonderful? We thought we'd try and make it a little more interactive and make it a bit different by talking about some of these things that we thought might help. So here, Francis, is your next poem.
Thank you, Virginia. I can do poetry. Science is a little bit more difficult. But let's see. To know a hill. Do not just see the hill. The old man walked here. Listen, the elder is telling the story. The water is talking. Listen.
So we know that knowledge from Indigenous peoples are incredibly important. Think about New Zealand, think about Christchurch and the earthquakes they had in 2010, 2011. And if they'd known to ask, they wouldn't have built Christchurch where it is. So we know disasters are everywhere, and in order to explain why this work is so important, I'm just going to take you through a few pieces of work that we have been much involved with, many of us. I had the great privilege of being the Vice Chair of the Science and Technical Advisory Group for UNDRR in helping to deliver the Sendai Framework for Disaster Risk Reduction, having worked with them from 2008 to 2017. The Sendai Framework is something that I'd love you to put your hands up if you've heard of it and know it. So do put your hands up. Okay, a lot of you still don't. It is the UN landmark agreement on disasters that came in at the same time as the Paris Agreement and the SDGs. It is absolutely critical for disaster understanding and what we can do about it. And of course, the meeting was held in Sendai because of the terrible earthquake and tsunami that happened on the 11th of March 2011. And we were privileged to be invited to go back to Japan to get this agreement finally adopted. It has one global outcome, 13 guiding principles, 4 priorities for action, and 7 global targets and 38 indicators. It is there to reduce mortality, affected people, economic loss, and the damage to infrastructure, particularly health and education. But it's also there to increase every country's knowledge of their risks and hazards and how they should look at it, build international cooperation, and encourage early warning for all. It links very closely, of course, with the SDGs, and if you look at them, the goals and the indicators do march together in part. But one of the things that has come out so strongly is that we need an understanding of the global hazards list. We've been sharing this already. It's been on the CODATA table, but here is the global hazard list. do know that it's there for everyone in the world. It's for everybody, and I had the great privilege of chairing even the second version of it. What does it have? Well, you can download it very easily with this little QR code, but also it's available in many ways, and it will be machine actionable and translatable into every language that you need. It has 281 hazards in it, hydrometeorological, so that includes the storms. Extraterrestrial, of course, UV is a huge problem here in Australia, and we know there's been problems even with the sun cream, because it hasn't necessarily been as protective as all. There are many chemicals in there, but also there are biological hazards. Absolutely at the heart of things, and COVID showed us how important it was. Technological hazards like cybersecurity, construction, waste, all these things are there too, as well as transportation, and environmental hazards, which includes wildfires. Geological hazards are there, knowing that we're very close to the Ring of Fire in the Pacific. But we've also been able to include societal hazards for completeness. It's not part of the Sendai Framework, but it includes conflict, which is why Ingvild's presentation is going to be so important. And of course, if we just look at the images of Gaza, the environmental degradation from conflict is one of the things that, of course, is a hazard and included. What do the hazard information profiles look like? This is flooding. You can't read it easily, but it's there with a clear definition and the highest level of that definition from the UN where we can, or those definitions may come from science domains if the UN has not done anything on it. We have information about health impacts, economic impacts, but also multi-hazard context to try and explain all the different hazards, as well as disaster risk reduction management recommendations and open source access peer review publications and who owns it. And here is the parent of the hazard at the top. So you've got everything from dam failure to reservoir failure to obviously hydrometeorological and other events causing flooding, but what can flooding do as a hazard? And that is below. So we know these hazards are really complicated, and we have to have a way of understanding these better so that we can bring the data together so that we can understand what the impacts are and how we can manage them better. Now, for health, we have the great advantage of having something that doesn't exist in any other UN domain, of the international health regulations, which of course came in very strongly with COVID, and the public health call for public health emergencies of international concern. It may be mandatory to the ministries and departments of health, but it is not mandatory to the whole government. So it's a huge problem that we have to really work hard from our health domain. And as a result, we've been working very closely with WHO to build health emergency and disaster risk management frameworks, taking all the things we know to build this framework which helps us to align global health security, disaster risk reduction, humanitarian reform, climate change, and sustainable development agendas. Because COVID showed us health is not a silo. Health bridges health and multi-sectoral communities. We have to work across everything, but we take it from all the things we know already. One of the things that Francis and I are very keen to take you to is the UN Pact for the Future, which came out in 2024. And as part of that Pact for the Future, we had this wonderful document on the Global Digital Compact and the Declaration on Future Generations, something that we thought was really key. And in Action 15, we will ensure that people affected by humanitarian emergencies receive the support they need. But in order to do that, we need to know the data about what they need. We need to build the resilience of the communities at risk. We also have Action in 38, which we will transform global governance and reinvigorate the multilateral system to tackle the challenges and seize the opportunities of today and tomorrow. Being prepared for the future, building capabilities, harnessing technology and data to anticipate risks, seize opportunities, act early and manage uncertainty. This is what we live with all the time now. This is what we will always live with. But one of the things UNESCO is leading on is the International Decade of Sciences for Sustainable Development. And we very much hope the work we're going to share with you now is going to take you into seeing that future. So UNESCO have been good enough to launch the CODATA resources. So let me take you through the open science mechanism, and this timeline of the 3 years it's taken us to produce this toolkit. And this is huge thanks to UNESCO and their leadership. They have been amazing to work with. We've done everything from having symposia to having consultative meetings, consultative launches, deadlines for feedback, webinars, soft launch, and then finally a formal launch in June in UNESCO itself in 2025. And now we have a way forward. So this is all about addressing crises from data policies and open science. It is the foundation of what we need to do. It tackles urgent and emerging crises with data policies aligned with open science. It's there to manage and mobilize data ethically, inclusively, and effectively across scientific, humanitarian, and policy sectors in our view. And it is the relevance to global emergencies such as pandemics, climate-related disasters, and armed conflicts, as Francis has already said. There are 3 resources that I've shared with many of you. One is a fact sheet. The fact sheet is why we need to do it, and I think you have it in your hands. It talks about values and principles which UNESCO are so clear on for open science, but it also talks about what we need to do both before, during, and after crises, knowing that many of these wheels will spin at the same time. But it tries to explain how we have to come to this need for a toolkit. Then you get the other thing that we've given you is the guidance. So this is how to do it. Francis has already picked up on the fact that we're looking at preparedness, response, and recovery, even for public communications and transparency, for resources and data data overload, as well as monitoring and evaluation. All these things have come to the fore. And you've talked about data management plans, which are absolutely critical. So these are all inside the guidance that I've shared with you. But the thing that I particularly like is the checklist. This is something that is really easy to read, and for my own data scientists inside the UK Health Security Agency has been the one thing that really makes them understand that they can do it and it is doable. There are 10 key points of establishing clear objectives and roles and responsibilities. Ensure availability of and access to adequate resources. Uphold ethical standards and protect human rights. Develop data governance and management protocols in open science frameworks. Facilitate open data collection and accessibility. Strengthen public engagement and communication. Promote interdisciplinary and multi-stakeholder and international collaboration. Oh, I'm glad to see a nod going on. Thank you. This is interactive, you know. It's not just me, but I just really want you to feel this is for you. Establish mechanisms of documentation, monitoring and evaluation, and plan for long-term preparedness and resilience. All of these, too, are totally available with these QR codes. So we feel that this is going to be real-time, reliable, and accessible data for first responders, scientists, and policymakers to help with cross-border and interdisciplinary collaboration and really use those open science tools and standards. Thank you, UNESCO. A hand going up. Okay. I've given you, we've got more copies outside, which you're very welcome. I've shared them with many, but please, this is for you to use. Many ways of doing it. Because what we're interested in is building the capacity for today's emergencies and prepare for tomorrow, and to bring in care for Indigenous people. We've done a lot of work on sharing this on the CODATA website. It's on the UNESCO website that came out only last week, which is really exciting. And of course, we've got these steps, these next steps we need to look at. So I'm very sorry to have talked so much, but are there any queries? Yes. Oh, here's one. Francis would like to come up and help answer.
Yeah, my name is Suzanne Den Boer from the University of Copenhagen. Without having read any of the material, I wonder at what level are you aiming for? Like policies at what level, or which institutions, or is any institutions that have any data, or is it, yeah, can you say something about who is your target audience for this material?
So, as you've come from Copenhagen, in Denmark, you are killing 150,000 chickens because of avian flu now. I know about it. But I feel that every farmer needs to know, is it the correct decision? Is it fair? To kill my chickens kills my livelihood. And it shortens the amount of eggs you're going to have to eat. Most times we can import to replace them. So to me, it is as important that the farmer knows it's fair, that your agricultural industry in Denmark should be using a way of sharing this information about why these decisions are made, but so will your government, who's going to make these decisions and provide compensation, we hope, through your Treasury or Department of Finance.
Yes. So in
But I also think your local systems, your local non-governmental organisations, the people who are going to be very upset and depressed, they need to know it's fair. It's accessible, it's trustable, it's a reasonable decision. So it's at every level. And one of the things that Ingvild will tell you is how important non-governmental organisations are, as well as government organisations. We believe it's for every level. Okay. And of course, avian flu affects much of Europe and indeed much of the US. So there's a lot of issues that affect other countries. So it's not just the animals, but it's the humans, it's all of us who have problems. But let's make it open, accessible, understandable, useful, usable, and used. Do you feel comfortable with that?
Thank you.
Thank you for asking such a great question. Another question, oh great.
Hi, Richard Ferris from the ARDC. I was very taken by the Al Gore movies about the climate crisis, and he was saying one of the things we're really bad at is responding to things that happen kind of slowly. So crises often happen in a short timeline, but we have, I wouldn't be surprised if we're in the midst of a whole lot of multi-decade long crises. So for instance, as an example, maybe something like autism is something that's happening over many decades, but also things like climate, also like is Donald Trump a crisis? So I just wondered whether the framework, can it work for things that, or another, like falling birth rates, for instance, though you know that countries' birth rates are falling below the replacement level. Things that happen over very long periods, can these also be covered in the crisis definition?
So the easiest way to respond to your question is our global hazard list. So this is the easiest way we can share with you the agreed list of global hazards. We haven't included vulnerability, we haven't included exposure, and things that are a bit more contentious, such as autism. I mean, there's been a huge change in diagnosis of autism in the medical domain. Has it been there anyway? But you do talk about slow burn crises. So let's look at something that is very Australian, the increase in desertification. The fact your deserts are growing. Think about sea level rise. Think of the vulnerability your coastline in Australia has. This is included in these hazards, things that we can measure, that we know that are globally agreed hazards. And I wonder if this may be a useful way of thinking about it. This is why we brought it in paper. It's available electronically in many ways, and I would be happy to share it with you. But thank you for asking such an important question, which is often rather difficult to answer. But at least we have a standard for hazards globally now, which is exciting, I think. Sorry, being the chair of it, it's been a painful experience, but a wonderful sharing experience. I see a question behind you. Sorry, sir. Oh, another one.
So on that note, I think you guys have done a wonderful, I'm Lars Eklund, I'm with the National Bioinformatics Sweden. I think you guys have done a fantastic job. What I would like to ask is, what procedures do you have for adding new hazards? Like, what is the procedure for incorporated when a new hazard is discovered in the from the scientific community? How is that incorporated into
this little hazard list?
Yes.
Okay. So we did a major review for the 2025 update, and it's all available in a report which I can share with you as well. We have included some new hazards. The UN Environment Programme requested that we should include space debris. I think a good idea. IPCC asked that we include marine heat wave. I think that was important. But we've been merging, reviewing, testing the hazards. And we know that we go out and we did a huge user survey, we did a massive crawl of about 40 different UN agencies, we discussed it with governments, we discussed it with the International Science Council and many who've been involved, the insurance networks, and many are there. So we've tried to reflect the hazard list. To prepare it the first time, we reviewed every single UN hazard list that we could find, and there were pages of them, let alone the contents. We reviewed every scientific hazard list we could find. I'm ashamed to say only in English, because we just had pages of them. Then we put it through a sieve and a sort, and in the initial version we had 302, and we've come down to 281. We don't know if it's perfect, but we want you to try it, test it, tell us how we make it better, because it'll be updated, we hope, in 2 to 3 years. But isn't it an exciting achievement that at least we have a hazard list to complain about, but also it might help a few. So the coral bleaching one was tested yesterday with one of the wonderful Australian projects, and she seemed to be really pleased about it, and I was so relieved, because I think it's a very important hazard. Thank you for your lovely comments, and I hope you all enjoy this, and I'd love to share this with you electronically. Thank you, sir. Right, there's another hand over here.
Yes.
Okay.
Hi, my name is Cecile. I was very happy to be an expert at the UNESCO for the Open Science Recommendation for the Association of Research Libraries. And I'm wondering how do you expect to reach out to other communities for the call in 2026? Because I don't know for my fellow and friends and colleagues here, but some communities didn't get, I don't know how to say, didn't measure the importance of providing feedback. So those who know or those who are aware of this, we monitor the UNESCO news letters and events and whatever it is, and we react. But I let them know about this already. I think there is something that UNESCO doesn't monitor very well, is reaching out at communities for having feedback on this. So can you tell us if you have any idea, or we can ask Anna Persic later, how you will reach out to communities for feedback in 2026?
Thank you for your amazing question. You're very wise. Anna is very much aware. And you, Cici, I know you come from France, so I know you can probably go and see them in Paris fairly easily. But we've had the most amazing support from UNESCO. Obviously, the World Science Forum will happen next year. There are many other fora, but the whole purpose is that we would love your engagement to see if we could do more in 2026, which is when they're going to start recommending that we do more, we hope. And we hope will be adopted as one of the outcomes from UNESCO for the decade of sciences for sustainable development. For sustainability, I forgot the name of it now, but just please know that we're really anxious to try and do it. But it's your help that will be so important for sharing this in any which way we can. This work is not for us, it's for everyone. And it should be useful, usable, but most importantly, used. So Cici, your help would be phenomenal. So please know that I'm really grateful. We are all grateful you're here. There's another question I see. Gosh, I love this. Come on, Francis. Come on. You wanted interactive.
Yeah, sorry. It might be a silly question. I was just wondering, have you found any resistance in sharing and being transparent with this data, given that some of it may have commercial or economic competitive advantage or national security problems?
Excuse me, where are you from?
Openmind.org. We do privacy technology. So.
Okay. I'm sure there will be issues, but I think COVID has made people much more aware that we have to share for all the pain of COVID. And as I was a senior public health advisor for Public Health England at the time, I can tell you that we worked so hard to share what we knew and to see if we could do better. And we're still going through a COVID inquiry in the UK.
The reason why I raised it, so I imagine, I'm guessing AI is probably on your list somewhere of risks.
So climate change is a driver of hazards. It's not a hazard.
Yep.
And having talked to the International Telecommunication Union, AI is a driver of hazards. It's not necessarily a hazard.
Okay.
So we've tried to discuss these more difficult things wherever we can and to make sure that we're more ready to respond, if that's helpful, sir.
Sure, no worries. Thank you.
But do come and look. There's some quite interesting cyber hazards if you're interested. There's all sorts of things in here. Okay.
Hello, I'm Romain David. I'm working in research infrastructure in Europe for that is federating BSL-4 laboratories. We are working on a highly pathogenic agent. And I'm wondering, because it's, you know, in all challenge that we have at the global scale, one big issue is the data fragmentation. Even if data is accessible, the time to reach all places and to try to mobilize them and after to aggregate them, it's too late. So for that, most of data stewards are recommending what we call minimum metadata requirement. That is a higher level, a very first small step. Do you have a policy about that and recommendation about that? I didn't have the time to read your document before coming, indeed, but first, I appreciate the checklist that is a kind of minimum metadata. We could imagine that like that, but minimum metadata requirement in a crisis about a particular event could be really great. And my impression is that we are doing that, each of us, in each region and each thematic differently. So what is ongoing on your side?
Francis, can you answer that on data stewardship? You're much safer than I am. Sorry, I'm just a doctor.
I'm just a philosopher. That's even worse. Yeah, thank you, Roman, for the question. I think it's really important. Yeah, I'm also involved in a lot of these European projects like monkeypox and COVID and so forth. And indeed, this came out of COVID. That was the initiative that led to us first do this meeting in Leiden and then go to UNESCO with it and so forth. I like the way you thought about using a checklist as a metadata. I didn't think about that. I'm sure you did. I'm sure Jay did. Madava there in the back also thought about it that way too, right away. Okay, we can. We have to operationalize this. So one is to pilot, but the other thing is we have to get it into code. We have to get it into a platform that people can use. And we have to, yeah, it's not going to be easy. You know, that's why we're working on the data visitation. That's also why we're working with the AI and so forth. It's all in the background of this. So the piloting, we have to come up with structures that help this. And one of the things that I had in mind, because I'm a DPO in Europe as well, a data protection officer, and I do a lot of these data management plans with these European Commission projects, and they're embarrassing, frankly. I mean, they don't work. People at the last minute try to find some place to shove their data where they can say to the Commission, okay, it's over there. But, you know, even within projects, people are nice to each other and they're really friendly, but it's really hard to share the data, let alone across projects. Say there's like 5 monkeypox projects going on from the Commission now. They're not going to share data across those projects, which is crazy a bit, but that's the way it's going to be. So we need secure environments. We need trusted research environments, things like that. And we need people like you who can program this stuff like this and put it into there. So we need the pilot projects. What we try to do right now, I've tried to do in Europe, is get a few of these European Commission projects to write it into their DMPs. So if we can put it into this DMP or something like that. So that's how we it's by hook or by crook, but we see what we can do. Yeah. So it's a long road, yeah.
Ilya, do I see your hand? Yes, I was right.
Thank you. We often have to deal with multiple disasters at once. Hazards don't happen by themselves. So we're looking at cascading disasters, multi-level, complex situations. And this means that different domains have different data policies, different PI, access constraints, and all these other elements of data lifecycle and data protection that have to be taken into account. So do you have recommendations of how to deal with these cascading situations, and whether you can separate problems at the, with cascading disasters that can be solved versus those that cannot be solved now?
So this idea of complex and cascading hazards is something that we were very much asked to address in our update of our hazard information profiles. The way we've done it this time is to do the multi-hazard context in our hazard information profiles. I don't think it's ever been as clearly documented and as referenced with the links that we've included, because each inclusion requires detailed knowledge and peer review of previous events. It is only, though, the parent, the hazard, and the child, but it's not every child that a hazard will have, and it's not the only parent that every hazard will have. We have tried to see if it works for people to get them to think more broadly. And when we tested the wildfires hazards, it was really interesting. People missed a lot of these things. You get fiddling again.
Yeah,
oh,
sorry,
dear.
Sorry, I know it's distracting.
Sorry, he loves fiddling. Great, you've gone too far.
Okay, that's okay, I'll stop.
It's all right. No, you can have fun. But this is how we've been trying to look at it. But if you look at the wildfires, it's even more complicated. A financial shock is very complicated, of course, all the drivers for that. But we're just trying to think about how we can get people to think more broadly, at least at one level, and preferably two on the children of a hazard, if that's an easier way to explain it. But it's never going to be perfect at the moment, and we need much clearer ways of documenting these in case studies. But I think at least it's a start, and UNDRR were very pleased that we managed to achieve this with our wonderful scientific partners. It's been a huge effort and exercise, and I thank Hélène Jacob-Descommes, who's been the project manager, for taking this forward in such detail. She's been just amazing. So the collaboration has been enormous. We've used Myriad, which is one of the European Union projects, and many of the others, like Damocles, to help deliver some of these things, but also the partnerships across the world to give us advice, if that's a help. But it's not perfect, it's just a step. So any other questions, or shall we move on and talk about the case studies? I think we can move on. Come on.
Maybe we did the 2 case studies and then...
talk further, because we need your help. This is asking for your help, please. Yeah. Do you want to roll it, dear friend?
No, I'm okay. I'll get to it, Fuji.
Okay, you're in charge.
Just go, yeah. Ingvild, we'll do a project first. That's okay, and then we get to, and we have to keep an eye on the time too, I think.
Yes, we're running out of time. Sorry.
Please, yeah. So this should just play by its, if you can make it play.
I apologize for my very freezing here because it was raining in Ankara. Hello everyone.
Perfect.
I sincerely apologize that I couldn't be with you in person at the International Data Week in Brisbane. When you watch this, I will be on a flight from Ankara to London. And I again apologize for my very freezing here because it was raining in Ankara all day today and I couldn't control it. That's the best I can do. And sincere apologies for 2 reasons. My talk today will be about from how the role of the policy, but thinking about the ancient data to our modern times, to contemporary data analytics, and why we need policy for this. So from ancient seismology to contemporary data analytics, the role of policy, what takes us here. And the previous presentation, which introduced you the open science relation with disaster risk reduction. So UNESCO-CODATA data policy for times of crisis facilitated by Open Science Toolkit, with a great fact sheet, with a great checklist, and with a great guidance like which brings us like 3-in-1, like a Nescafe. That's a brilliant package for a person who works in disaster science, who works in data science, and bring them together. So what brings us what takes us from the ancient times to today is, let's start from this picture to give you some sense. I'm sure you have some guesses what it could be. Some people say it's a teapot, like a classical, like samaware, they call it in the Middle East, where you boil tea. I see some dragons, little dragons on top of it. It's made of kind of metal. So I see some animal figures at the bottom. So this is the first device to record earthquakes. Where? In ancient China. So it's called seismograph. So the data, the history tells us that the first ever recorded and registered earthquakes, data about earthquakes, come from ancient China. A Chinese philosopher came up with the idea of this device, which is seismograph, that we name today, like with huge scientific developments. It has been invented in AD 132, so more than 2,000 years ago. So that graph shows a dynamic. It's a sketch of how a seismograph would work and how it would detect the earth vibrations and how it would record it and give some magnitude, some intensity to that data information. Another ancient graph for you from this link, Bresson 2011. So this is a catfish. It's called Namazu, and the ancient Japan. You know, Japan sits on the Pacific Ring of Fire, vulnerable to multiple hazards, and earthquakes is one of them, very important one of them. So people in the ancient Japan used to believe that when they behaved badly in the society or community, they were punished by earthquakes caused by a giant catfish living underground. So they tried not to make him angry, not to scare the catfish Namazu, so that earthquakes wouldn't happen, so their houses wouldn't collapse, people wouldn't die, there will be no injured, etc. So this is again ancient information that we have from the Japan, east side of the world. So these things improved, time went by, research developed, science improved, connections, knowledge was shared, and we come to today. I'm going to have a big jump in the time zone with you, please, and take you to the 21st century. This data now, because we have lots of hazards defined, I'm sure you're going to hear about the HIPs, the Hazard Information Profiles, which is a project led by Professor Virginia Murray, and it lists like hundreds of hazards, almost 300, a little bit less than 300 hazards listed. So there's drought, there's earthquake, there's extreme temperature, flood, landslide, mass movements, storms, volcanic activities, wildfires that we are facing every day. And as time goes by, the type of the hazard changes, the damage level changes, the frequency changes, so it happens more often than we used to face it, and it is recorded. Thanks to today's science and improving technology, I'm sure it will be highly developed in the future. I can't imagine the next 10 years, 20 years change, but this graph, like sourced from CRED in Belgium, this shows us the comparison of some hazard information, some disaster data between 2009, 2018 and 2019 only. So almost a 10-year, 9-year coverage is equal to 1 year number of event occurrences as a drought, we name it. Earthquakes, same wise. So 2019, that shows, so that data, that analytical, this infograph tells us the number of the events happened in 9 years time is almost equal to, in some places more than, to the events which happened in just a single year, 2019. Okay, that table, this type of figures can be produced more and more with the improving technologies. Another one that I would like to share with you, that's from the USGS, United States Geological Survey, that shows the intensity of the earthquake in Turkey, which occurred in my country. I'm located in Ankara here, by the way, which is here, the capital city. So it happened in eastern Turkey, caused by the rupture of the East Anatolian fault line, which was expected because science told us there was a seismic gap. every scientist about earthquakes who work in earthquake engineering, geologists, geological engineers, they said, please expect a big earthquake in this area, especially in this area, in the city exactly, Kahramanmaraş it's called, because there's a seismic gap. So there's an accumulated energy from the movement of the tectonic plates which needs to be released. And every risk reduction plan was in implementation. People knew, people were aware. But still, that was the centennial earthquake, which is the most devastating in the country's history. So there are earthquake records. In Istanbul, there is Bosphorus University, Boğaziçi University, Kandilli Observatory Center. And Kandilli Observatory Center has the oldest earthquake records in the country. It dates back to 1800 sometime during the Ottoman Empire. There was a seismology center here where they collected the data, observatory center. So from 1800 onwards, there's a data accumulated here. And Turkey has the largest number of the ground motion seismic isolators, seismograms insulated in the country. So I think it's more than 1,200 now. That is the largest in the Mediterranean region and in Europe. Like we have lots of seismograms. That little pot that you can visualize at the first slide. Now there is a technologically improved and developed versions of like the modernized versions embedded everywhere in the country to collect the seismic data, real-time data, motion data at real time and continuously. So there's a center in Ankara at AFAD, the Turkish Disaster Emergency Management Authority, which records the data. So talking about big data and AI, it's there. So we are recording every single movement of the earth in my country. In Istanbul Kandilli Observatory Center, every movement of every location here in the country has been detected and recorded. So it is there. So technology helps us with that. It's statistics, it's data science. So what happened is on the 6th of February 2023, and the first earthquake, which was 7.8 in magnitude, occurred in the morning at 4:17 a.m. And very drastically, a second one, 9 hours apart, with 7.5 magnitude, happened in this location as an epicenter. That's the first epicenter, that's the second epicenter, but it is the same province jurisdictionally, so which was really a shock. And a third one, in the same week, occurred somewhere here in the city called Malatya, and that was magnitude 5.8 if I'm not mistaken. So 3 big earthquakes we can name in the same week, in 1 week. It is really very rare and extreme event, and that is data. Okay, having a lot of scientific background from ancient seismograph invention until today, 2025. Science developed, technology developed, people are aware, knowledge is shared, open science supports us to become more resilient against disasters and hazards. So the problem is, like in the chaotic situation we experienced personally in my country in 2023 is, there is a lot of information, there is a lot of knowledge at different places, at different times, not accurate all the time, not timely all the time. Sometimes ethics is an issue, sometimes implementation is an issue, sometimes the community is an issue, everything. Like there were lots of problems because of the lack of the policy. That's why we need to be very, very aware of what's happening around us. We need to be very much keen on translating the scientific knowledge into policy to create resilient communities and countries. That's why the fact sheet checklist and guidance you have been introduced previously is like very, very crucial. If you don't have any data policy, you keep collecting data like we do in Istanbul, in Turkey for past 200 years, you can collect the data. But if you don't have policy, what's the use of this data? So our toolkit, the UNESCO-CODATA toolkit, is a perfect tool to bring the data analytics and governance, good governance in disaster risk reduction together by using the crucial policies. I'm going to end here, not to take too much of your time. Thank you for your patience and attention. These are my emails as contact data. I'm happy to hear from you if you have any questions or any feedback, if you want to get in contact with me. Thank you for inviting me to this session as well. Have a lovely day, have a lovely data week.
That's Persic. She always steals the show. Virginia and I were in London with her, and we were both talking, doing everything. The next day, Persic is on BBC. So we're terribly jealous of her. And then when we ask her, oh, can we meet with us? No, I have to meet an ambassador today. I can't come. So we're jealous. Yeah. Anybody want to? I can't answer the questions. Virginia or Ingvild might be able to answer, but any response? No. I thought it was nice, a little bit of history, a little bit of understanding where we're coming from with all of this idea of data, all of this idea of science around nature, around crises, and I thought it was very good here. So, Ingvild. You now have the big task. Yes. Yeah. You don't. Oh, I'm sorry. I skipped your first slide.
Yeah, that's fine. That's fine. I guess they had enough time to have a look at it. So, hello. Good afternoon, everybody. So, thanks so much for being able to talk to you today and share with you research that I've been doing for 30 years, and also hopefully being able to get the information out why I think the policies are so important and why it's so important to my work and also the various stakeholders that I work with. I assume that not everybody knows particularly what kind of group I'm talking about when I'm talking about the children born of war, which is why I would like to just start very briefly with this. Very often people think these are generally all children in war. It's not. Children born of war are a very specific group that many people, when I talk about this topic, say they've never thought about, but they actually realize they usually have them in their societies. So we're talking about children that are born just because there is a war. They wouldn't have been born otherwise. That means their father, it's usually the father is a member of a fighting force, an enemy force, a rebel group. We've changed a little bit the definition with the changing warfare during the past decades, and where the mother is a part of a local community. We have children born of war all over Europe. The first one I found was actually from the 18th century, but particularly known to many of this group may be the children born during World War II by Germans in all occupied territories, Norway, Denmark, but also in France and the Netherlands. In recent decades, there's also been increasing information and research projects on how these children have actually experienced growing up as these children, war children as they are also often called in their respective communities, in the post-war period, and partly devastating. So there's been a couple of research projects on that, and I'm going to show that in a bit. Now, in today's societies, and that's also what I'm going to come to because I work with Save the Children, I work with UNICEF, I work with a lot of the other NGOs that are in the field primarily to save lives and support the children, but also the mothers that are experiencing rape, conflict-related sexual violence. It's another kind of pandemic, but it's what we call a pandemic in geopolitical conflicts. It is used widely as a tool of warfare, and it is also prosecuted by the International Criminal Court, but it's still happening at wild scale. Needless to say that collecting data on these issues may be highly both dangerous and it's highly sensitive, as it's still very much tabooed and may also be dangerous to the women, but also to the children. Now, when we say here that we have a much broader definition of this, you can see we don't say that it's only the one or the other. The children can be born due to more or less consensual relationship. In the Scandinavian countries, it was even partly love affairs, and also, by the way, France. But as we do know, in war times, what is consensual, what is not, may be a very blurred thing, which is why, based on research and academic knowledge, we have decided at this point in time that we look at how what do the children, now in the meantime, they're no children anymore, they are partly in the 80s, but what is it that actually share and what are their voices and what are the common denominators across all times and conflicts? So this is a summary of some of the results, trying very nicely due to time restraints to squeeze into some of the models that I like to develop. I should probably mention that when you see the name Mohmanen a couple of times, that was my last name for 20 years, and I've changed it, so it's actually my work that I've been now doing for 30 years. I never thought, by the way, that this would keep on for so long when I first started it, but that's another story. So as you can see here, and this is what it was said with regard to, I think it was you mentioned, we do have a lot of research. So in the preparedness of crisis, of course, it is relevant to look at what is existing in academic research or in research in general, which we use very strongly now in our work when we do informative webinar seminars, for example, in Ukraine with the foundation, to give them a state of the art, telling them, it sounds a little bit bad when you say, well, you know, we know this and this will happen and these are the consequences. But simply the fact is, it saves us a lot of time in intervening very quickly at a point, getting the message over to the first responders. What is the state of the art of research? Don't try to, figure out that this is something very special, or if you know this, you may see what is very specific for the context and the crisis and the conflict that you're operating is, which is why we are also so eager to cooperate and also get this information from the field. So you can see it covers health, psychological, immediate responses with regard to health. Infanticide is also widely spread. So the question is then, who are you in charge of? Who the health workers you need to respond to? What would be the best mechanism to set up something in humanitarian crisis to support? Now, why is this so important? And I think I already mentioned this, is that, well, the book at the left is a book recently came out from a Dutch photographer who learned about the Lebensborn program of the Nazi Germany, which was to support and secure the Aryan race. And she's documented now the life stories about 9 people across Europe who, for various reasons, were part of the program, were kidnapped, their data was manipulated, they were adopted to Nazi parents. They didn't know, they thought they were the real parents. Some have never been able to find out what actually happened to them. Identities were just simply stolen. Well, why am I telling you this? It's a book that came out in 2024, which is really impressive with the photos on how this has affected them, their whole lives, but also the next generations. Now, most of you know about the children stolen in Ukraine that have been transferred also to Russia that are for ideological reasons, many of them now indoctrinated and partly also sent back to fight against basically their own people. There's a lot of information in the meantime about this too. But why is this information available? Because journalists, because humanitarian agencies, because there have been people on the ground that have been very quickly in trying to collect the information and the data they have accessed. No doubt, it is maybe questionable with sorts of representativity, validity, and reliability. My argument is that if nobody starts collecting and looking at these blind, white, and ignored spots, we're never going to get to know anything, or we will just know about it 80 years later, like in the book of Agnette. So, and that is something which I see as a highly moral question to today's both people and researchers in the field. So we've been engaged in also in the Rohingya and in other cases. Now, yes, everybody knows here when you come from the academic field, we have a lot of sources. I don't need to tell you that we have research, qualitative and quantitative rich data sources that are what we consider to be research data. And I'm engaged in a huge ERC project at the University of Oslo at the moment called Eurowatch, where we collect data and we do interviews and all this. But it's just important that it is that in the field that I'm working in, everything is data. Everything. We work with church books. We work with faked or manipulated birth certificates or real certificates. We work with administrative data. We work with court records. We work with anything, satellite pictures. Everything turns into highly relevant preparedness data, but also collecting because it may be important also for new interventions. And this is one of the things which is in yellow there, which is why I see also particular DPTCs, that's policies, the toolkit, the fact sheet, and the checklist for so highly relevant is that trying to get this information to the people in the field that I work with, the NGOs and civil society organizations in a very timely and immediate manner that, you know, what you do is highly relevant to us. We need to find ways where this data is collected and shared timely because these are groups we otherwise would simply not know about, which is why I and my team in this Children Born of War project have tried to visualize this and show you these are the different kinds of sectors and pillars of data sources that are highly relevant to our field. The communication across these are sometimes rather poor. These are silos. Try to talk to people in NGO about data management plans, about the FAIR and the CARE principles. Not even the OSHA new data responsibility guidelines from 2025 mention FAIR once. So how do you get the interoperability going with all these fragmented questions of ownership, of ethics, of sensitivity of data? How do you manage to then actually use all this relevant information in a very quick pace? And then the Murad Code, I'm sure that nobody here has heard about, but they are from Nadia Murad, who is a survivor of from ISIS slavery, got the Nobel Peace Prize in 2018. And the code that she mentioned is also related to how do you collect data and documentation and get important information without having to ask the victims directly themselves, but use other kind of data and documentation in order to do it. So to finish, the Children Born of War, an example of a long time ignored group of war-affected children, but then have gotten increasing knowledge, which has also a backside, a difficult side too, but let me take the positive first. So we need this awareness building across the silo and gap much more the academia, civil society, and policy. And actually in the previous session I was on AI and research data management earlier today. There were other people who saw exactly these issues too. So we have thought about that this International Data Week and also the RDA, we need to get many more of these representation of the organizations from the fieldwork into what we're doing so that we are able to push these policies forward, because I think that's essential for the success. It's also a question of giving voices to hidden population and making them visible on the agenda. I mean, we are here at the conference talking about data for positive change. Yes, well, who communicates then and looks for these groups that have no voices of themselves? And by the way, thinking of the plenary we heard on Monday, I was thinking about all these groups that were presented there too. They have diversity of voices. So we need also to be very aware of the fact that there are very often a selection also among the vulnerable groups of the voices that are heard, that are being heard, and that they are maybe not diverse and representative for a whole group, which I think we are very often not discussing when we talk about also the data. So present conflicts and emergencies, so we need closer cooperation in the field. So the challenge, as I said, is the coordinated data collection, documentation, and the sharing procedures that I totally see and agree upon. I have no solution, but for my little work of field work, I'm going to take the challenge and try to do it. So I've started this, so we'll see. But at the same time, not endanger and making victim groups and ethics. That's been one of the really important things that people, the grown-up Children Born of War, have told us to. Don't make us a victim group when you want to do a positive change, because that doesn't help us at all. And the second, and then that's also my final slide, is that the data is crucial for monitoring the existence of children born of war in ongoing crisis, and also informing intervention and managing responses, as well as collection of evidence and abuse of documentation of present children born of war. As I said, we're engaged in Ukraine, but also in Sudan, South Sudan. We got requirements from Ethiopia and from other countries too on, can you please tell us what to do and how to do it the best way? And also the mitigating and monitoring of evidence-based responses. And I think a saying I always heard at our meetings, what you cannot manage, what you can't measure, but what does this mean for the hidden populations, as we call them, the ones that I'm working with? Who has the responsibility to look for the children nobody wants in present conflict zones? Or for other groups of people. We do have a hierarchy of victims, and we need to talk about that too. So implementing the data policies for times of crisis is what I am telling everybody I'm dealing with in the sectors that have never heard about it, never cared, and are not interested. And I don't blame them, because they have enough to do with saving lives. But communicating to them how important this is for our work and for actually building sustainable processes to be able to help these groups, that gives them another touch and a trigger for understanding that maybe also the immediate work they can have, if we find a mechanism of sharing that information, can have long-term impact. And that's a way of communicating it. Not that we have these nice policies, which we do, but they're very important to have. So that's one of the things I'm very happy about. And now, you may say, well, this is a very small group. No, it's actually not a small group, but maybe a group that is very specific. But these kinds of issues that I've told you about now exist in so very many other groups. Just thinking about migrants, minor migrants in Europe and everywhere. We know that there's a lot of these problems. Also following, by the way, earthquakes in Haiti and a population where 50% are under the age of 18. And who is looking at the societal consequences for this population now 15 years after the earthquake? Anybody heard about Haiti lately? No, probably not, except for you, when you do that. With this, I will stop. So thank you very much.
I think you need some questions.
I need some questions, well.
I'm sure there are questions.
Virginia, come and sit here. And Ingo, sit here.
Yeah.
And we start with questions for Ingo. We'll go here and then to Gnana. Is that okay, Gnana? Yeah. Thank you. Thank you. Thank you. I didn't know who was first. I wasn't.
Yeah, Susanne, University of Copenhagen. I'm not quite sure this question is forming in my brain as I speak, so I don't know if it's more of a comment, but I kind of try to pull it down to my work at the university. What I think you are saying is that we at universities must raise awareness so that researchers understand that their data, even if it's cross-disciplinary, are important to inform decision-making in times of crisis, right? The problem is that our researchers sometimes don't even recognize they work with personal data. So we have to get them to classify data, to understand, and especially if it's cross-disciplinary, they collected it for one purpose, but actually as a side effect, it probably would be very relevant for people like you to know about, right? Is it, am I translating it correct to say that we should increase awareness at universities for researchers to start thinking in a broader sense, and that their data can be impactful in crisis management?
Well, yes, certainly. And so that's for one part of these silos. So I think that, the academic research is a question of where do you communicate it also to. So this is a part of the knowledge transfer in that setting too. Instead of very often what researchers do, thinking about the next publication and their impact factors. So it's a question of the dedication also of getting your information into, of course it depends on what you're doing, but I think a lot of research that is being done could be of great benefit to the next step of the silos and the next step again, because very few research areas deal with such ground research that it is at a point where it's not necessarily or useful to share it. Yeah.
And can I add a comment? Thank you for raising this. I'm really glad to say that the UK Research and Innovation team looking at their data strategy have linked to our toolkit. Isn't that exciting? I don't know how much they'll use of it, but if we can get them to think about this across all the research sectors, I think it'll be increasingly important. And more we can share, the easier it'll be. We won't get everything, but we might get some. Gnana.
Yeah, thank you, Dr. Odegaard. This is Gnana Bharathy from Australian Research Data Commons. As I was listening to you, I thought this is a fascinating research area, seldom covered. But I was also thinking about the implications of consent or being revealed somebody as a child of war. And so how do you handle this? Because the consent goes beyond one generation. The grandparent may have been involved, may have directly given consent, but what happens to the descendants and who may become identified as a descendants of war? War being hostile, and which is surprising. So how are these children prejudiced or in the subsequent generations, or for the person themselves? Thank you.
Well, thank you very much for the question. It's one of the challenges, of course, that we're dealing with. So we need to talk about the different, also the kind of the stages, of the life cycle. So if you, for example, take the children in Bosnia that were conceived in the so-called rape camps, one of the strategies of the Bosnian government was to delete all files and documentation so that the children would never learn about the harm and what happened. The thing is, they learned it anyhow. The only thing was that they weren't able to access any files because they had all been destroyed. Who has the liberty to take the decision to destroy on your behalf what is relevant to you as a person personally? You can always choose what you want to know, but if it's gone, it's gone. So that's the one thing. The other thing is, and you're certainly right, in present conflict zones where it's really danger, where if you try to implement programs, and we have examples from the former child soldiers in Uganda, where in order for humanitarian organizations to follow up on the children returning from the Lord's Resistance Army with their mothers, they had names and they had documents. Then the fathers tried to find them and were eager to get hold of the files of the humanitarian aid workers, so they actually got in danger because they knew they would have the data on that. And that is one of the challenges where you need to balance based on the setting, what can you do? Because there is no way you'll be able to kind of totally work around this when you talk about conflict zones.
So we can go
yeah. Oh, yes. Oh, yeah, because, sorry, yeah.
One more question.
Yeah.
One more question.
Just a quick question with a short story before. I'm wondering, so Romain David from ERINA, I'm wondering if you know the data break, you should have this data break, data fracture more than us. I want to tell you a story in pandemic preparedness situations with a lot of scientists. When I have asked from some scientists, do you have data? And they said, no, we don't have data. We only have results. And that means that there are sometimes no willingness, but also sometimes no comprehension of what is important in data. And in your case, that must be worse. So what is the plan? How can we mitigate that? Because that's the first step, isn't it?
Well, the first step is just trying to get everything in every kind of setting, because in every kind of setting it will be different kinds of data, which may be existing, may be relevant. So we ask for these things, and of course we make them aware of these things. That's what I presented here, that think about data in the most widest sense you can possibly get. And then the next thing is the storage, the sensitivity, the sharing, and the interoperability.
Okay, good. Thank you. Stay here, Ingvild, someone. That's research assessment, huh? If people don't value the data, if they don't say to the researcher, it's not just your publication that's important, but your data is also important. That's why we got to do that. Virginia, Ingvild, I just want to say thank you very much, and also to Bocek, who's not here. Really nice presentations. As Virginia will remind me forever, it took us 3 years to produce 3 PDFs of 3 or 4 pages apiece or something like that. And she will never forgive me for that. But I have to say, it was really difficult. It was really difficult. And I was sitting here because it meant thinking outside the box. And the box is this box of policy, regulation, ethics, and so forth that is so confining to data. And how can we get outside of that box without destroying the box itself in a certain sense? That was the hard part. And it took a lot of thinking, and a lot of people were involved. And a lot of work went into this, really. And also a very global group, a really impressive global group. Very much thanks to Virginia, but also Ingvild, and really dedicated people who worked right up until the end and stayed with us until the end until we make it. So that's the most important thing. And as Virginia always says too, at the end of the day, this is not about the data. It's about the people, as Ingvild has made really clear in her presentation too. It's not about the data. It's about the people. And getting people to cooperate through these data, getting people to cooperate in data through the data policies, we hope will also get them to cooperate in their science, in their sharing of information, in their thinking of strategies and thinking of methodologies and things like that. So that's really what's at the basis of here. I think in just the last few minutes, oh, thank you for putting that here. Virginia, you want to go through that one more time, and then we have to get some feedback from these fantastic people here on how we can do something useful going forward.
I don't think we need to read it again, but we'd love your feedback. So will you go around with the microphone, or shall I?
Oh, you should do that, please. Yeah.
Okay. Because you've got to read a poem. Okay, any comments? Okay. 1, 2.
Hi, Richard Ferris from ARDC. One of the things I study is value, what's important to people. And one of the great things about a crisis is you don't want to waste it, and that one of the great benefits of a crisis is that people unlock the normal way they do things, and they do things a new way. You know, like with COVID, we were able to change. I'm sure if there was an asteroid coming that was going to smash us all to pieces, we'd suddenly find $100 billion to go and fix it. But so I think one of your challenges is trying to get people to imagine they're in a crisis, and then how would we make those changes now and being ready. I just wondered if you wanted to reflect on the challenges and getting people to kind of imagine they're in a crisis.
I think with COVID, you don't need to bother to imagine. You've been there. We've all had crises in our lives. The one wonderful thing about the UNESCO work is they have values and principles. And I think that achievement alone was absolutely huge. So thank you very much for all your work. I really mean it. So if we we are all in a crisis, and there's a thing called climate issues. I've never heard of that, really. At least somebody I know hasn't heard of it, but it's a huge problem. But thank you.
I had 2 comments to make. My name is Paula Martinez. I work for the Australian Research Data Commons, my colleagues. One of the comments that I wanted to make is thank you for presenting this information to us and making us aware of that we live in constant crisis. And I think in wealthy countries, people mostly think, oh, crisis is happening on the other side of the world and we are not affected by it, but we need this reality check from time to time, and it's really happening every day in our lives. The second comment that I have is about policies. I was in another session for a different kind of policy, again supporting open science. And there was a comment about policies is a very strong word in some languages, so going outside of the English language. Some people said we cannot make policies because that's legal binding and we might not be allowed to do that, or we don't have the support from our organization to make a policy. But what we could do in a very similar way is to provide guidelines, and I think that's what you have made here available for people. Thank you.
Thank you for your wise words. And you also know that UNESCO made the recommendations for open science, but they encouraged us to take forward the idea of policies. So I think you found yet another little semantic issue of some note. Do we have any other comments from all of you? You are just so welcome to feedback anything. Oh, thank you.
It's a comment from all of us to all of you. Thank you for this work. It's a global good. It's a common good. We all need it. We'll all benefit from it. I'm humbled to be in this room and see the quality and scope of this activity. And I've worked on contaminant spread, poison spread, airborne spread, fire, disease, and geez, this intersects all my work. Thank you.
Thank you for your lovely words. You've almost reduced me to tears. We just want your help. And if you'd help us, provide case studies with us, work with us, we'd love that.
Thank you. I would like also to add thank you for your work and all your presentations. And that's really important to see that we can work on the same way in different disciplinaries for different kind of topics. And what I wanted to say is sometimes at all level, we are a bit disconnected from the upper level and the lower level. I'm working in ARIs, and ARIs are disconnected from institutions on universities, for instance. And that could be also the same in the other sense with international organizations like UNESCO. And this time, it's not the case. And my willingness is, how can I help you more?
Please work with us. Please collaborate. We would love that. In the CODATA message, Francis has left his email for everyone. He decided to be the common factor, so do email Francis. But of course, we're all working together, and to have your support would be amazing, because I think this is such a difficult area to consider. But we couldn't have done it without UNESCO. Is there anybody else who has a final comment? Because otherwise, we'll do something different, just for a second. Oh yes, Cici.
So this is not a question, but for conclusion, we should have in mind the work that UNESCO is leading with the diplomatic area on those questions, with industry and with the defense institutions. So we really have to keep this in mind, because we live in a researcher world, and this is sometimes a bit different than other realities. Thank you.
Cici, there are many realities, but we hope that the policy will help to make people think more widely. But I thank you all for being here. We are very touched, aren't we? Francis, over to you.
Thank you. So I have to read another poem, as you can expect. But also, I wanted to make an announcement. So we are going to have a new podcast series on YouTube, and it's called Nighttime Readings of the Harvard Information Profiles by Professor Virginia Murray. It will be a 50-part series, and you can all sign up for it, okay? Yeah. The old hand. The elder's hand on the canoe, the dreaming in his hand. I belong to the song it carries, and the story is in the making. Thank you.